Hello, this is a really short Lesson 4 introduction. Lesson 4 um, concentrates on Chapter 3 of your textbook. Chapter 3 includes how illness is distributed in the United States, or what types of illnesses individuals tend to suffer from uh, based on their gender, age, ethnic origin, social class, geographic region, and additional other factors. Many times we don't give enough credit to the fact that our society is extremely stratified, meaning there are significant differences in layers of society. And in healthcare, that is certainly true. We know for a fact that the higher the educational level of the individual, the higher the income, and based on the geographic region and occupation, um, the delivery of health services can be dramatically different, and so can longevity in terms of average lifespan. We do have a introduction in your notes. I've included some suggested readings. Anytime you see suggested items, it also includes the words optional beside of it. I include the information for your purposes only. You may be interested in learning more and investigating, or you may not, and that's okay. It's optional. Also in this lesson, again, we have Chapter 3 readings. We have several websites to take a look at, and they allow you to investigate your individual geographic location to identify health patterns. We, of course, have a Lesson 4 discussion board and a Lesson 4 Chapter 3 multiple choice quiz. Last but not least, I'm asking everyone to read something that I wrote back in 2005, which was a thesis paper when I was at Wake Forest. And the topic was healthcare in the United States since 1940. And the period I looked at was between 1940 and around 2002, 2003. And it traces back the major players of the healthcare system and talks about how we ended up with this hybrid public versus private system that really isn't extremely effective in modern times. 70 years ago, it was. But our entire medical system and the way we pay for medical care in this nation is problematic. And we're finally beginning to see the past 20 to 30 years how problematic it really is. The paper answers the questions why healthcare tends to be attached to jobs, to employment. It also asks and answers the question, why have we tried in this nation since about 1940 to have universal health care for every citizen, and why we have failed every single time legislatively. And the Affordable Care Act is not the first time that there was an attempt to provide health care to citizens of this nation. That attempt goes back many years to your grandparents. And most citizens don't realize that. They just believe this universal health care model, or having health care available to all citizens, is a new debate, but it certainly is not. And you will learn some interesting history about Medicare and Medicaid and other federal programs as well. I'm sharing this document with you for multiple reasons. The first reason and primary reason is to provide a really good foundation so you will know and understand the history of healthcare service delivery in this nation since 1940, 1920 to be honest, and in the early years. If we can lay that foundation of history, then we can begin to understand the challenges and begin to understand the bigger picture that we will be reading about and be faced with in terms of the Affordable Care Act and the current debate that we're having as a society. In the meantime, I look forward to your conversations. The Listen For discussion board is on my thesis and the material contained within it. And take care.